everyone, and welcome to Your Health in Your Hands. My name is Dr. David Ajibade with the Brain and Body Foundation. I want to say again, thank you for staying with us and for being so engaged on the platforms in what we're doing. So thank you so much. For this next series of episodes, we're going to be talking about neurological or brain disorders in children, and I think this is a topic that is very near and dear to me. I had no idea that there was such a problem in this country. A quick example, just a quick clue, is that up to 70% of births in this country are not being done in a hospital. You may ask, where are they being done? Well, in a hospital, not a hospital, in schools, in churches, in traditional birth attendant places, and at home, anywhere else than a hospital. And so, why is that a problem, you may ask? Well, it's not a problem if the delivery process is uneventful. The woman has a maybe 6-hour labor and boom, the child is out, and the grandmother or a skilled midwife is there to take care of the sanitation and the hygiene and take care of the baby. The problem arises when there are complications. Maybe the birth canal is too narrow, maybe there's an infection, maybe there's hypertension, maybe the woman is diabetic, she has a pre-existing condition. All these things can put that delivery process and that child at tremendous peril. And at our foundation, as some of you know who are familiar with our work, we see a lot of these conditions. Children who, for some reason, some of them I've mentioned already, stayed in the birth canal for way too long, and they didn't get enough oxygen, they didn't get enough nutrients, and it damaged their brains. So we have kids with cerebral palsy, and then you have kids with infections. Some kids actually have autistic-like symptoms. Some actually become dyslexic. Some actually develop seizures, just seizures. So we see a whole bunch of these conditions, like I mentioned. And again, that is as a result of events happening at or around the time of birth, the perinatal period, it's technically called. So we wanted to say, well, let's first of all educate Nigerians on these perils and these issues so that you don't take your pregnancy for granted. For instance, you want to go to a hospital, you want to ensure that you enroll in a prenatal class, antenatal classes, ensure that you ask all the questions, ensure you take the nutrients and supplements, ensure you're taking the right kind of food, ensure that you are not putting the wrong things in your body. There are some things that you think are okay, but they are not. Also, you want to be careful too about if you have a fever or a discharge during pregnancy. These may be subtle, but there are signs that something is going on. If anything affects you, it's certainly going to affect the baby. And there are crucial times during which the development of the brain, the whole 9 months are crucial, but the most crucial window period for when the brain needs maximum development are usually that first trimester. And so anything going wrong around that time, maybe you don't have enough folic acid, maybe you don't have enough vitamin D3, or you don't have enough omegas, or you have an infection, or you're working in a lab where you're exposed to chemicals, you're inhaling chemicals on a daily basis. All these things can affect your baby in a way that you cannot begin to imagine now. So I just wanted to mention at this start of this program that your pregnancy period is crucial. You need to get all the information, and this is not just for the mothers alone. This is also for the fathers. You have to play an active role in this. Study, research, ask your doctors questions, your nurses questions, ask your relatives. What do they do right? What should they not have done? What mistakes did they make in the past? Because again, all this affects the health, especially the brain health of your child. And once these things set in, it's very, very, very difficult to get to treat. Remember, the brain is the most complicated organ in the entire known universe. There is nothing more sophisticated or complex than it is. A slightest tiny cubic meter of brain cells the complexity is just boggles the mind. So to treat and to address brain conditions is a big deal. So let's in this series, in this segment here, we're going to just do an overview, and we're going to talk about some of the things that we've found out that have been helpful, so that even if you're in that condition, even if you have a child that you are dealing with that has these issues, I want to say that hope is not lost. That there are, with new research, with new brain imaging technologies, with new diagnostic tools, and even with new therapeutic tools, we now know that we can effect certain levels of recovery. And that's exciting for me because I've always been interested in the brain and how the brain works. And so we were trained in medical school that, when the brain is damaged or you've lost brain cells, that's impossible. It's impossible for you to regain those brain cells. And I know some neurologists still hold on to that fact. Well, the truth is now we know that the brain can actually reproduce new brain cells even after they've been lost. And there are certain centers in the brain that can do just that. And I think that's really exciting. Like I said, your brain is actually producing new cells every single day, even at an older age. But the cool thing is that with children, the reserves are so much greater. So if we can catch them at an early stage, there's a lot that can be done. So I want you to stay tuned, and we will get right into it when we come back after the break. Welcome back. We're talking about brain health and neurological disorders in children. And I want to read out this, or just say out this quote before we get into it. It says this: I am convinced that proper digestion is the great secret of life. And it's by a philosopher called Sidney Smith. I got to tell you, when I first read this quote, it was actually given to me by one of our professors in biochemistry when I was writing my first book. And I asked him for quotes, and that's what he sent to me. And I got to confess, when I first saw it, I was like, what is this? This is a biochemistry professor. He should be talking about things like DNA or RNA, some biochemical equation that is highfalutin. What's this about digestion? I mean, what does that have to do with anything? And in my ignorance, I just kind of put it aside. But over the years, especially when we've started working with children with brain disorders, we've come to see, and for me, it's been an absolute revolution, a breakthrough, really. And I really feel that it's something that neurologists and neuroscientists, and especially those pediatric neurologists who deal with children with brain disorders, I really feel it's something that they need to know and they need to understand, because this is crucial to how especially if you're dealing with a child with a brain disorder, it's crucial to their development. So why is digestion, or why is the digestive system so important in brain health? And again, we weren't taught this much in medical school. Obviously is that food comes in through the mouth and into the digestive system. Your body to recover, for your body to heal itself, to repair itself, for your body to function, to metabolize, for your eyes to see, they all need nutrients. And these nutrients could be building blocks, they could be enzymes to help to facilitate chemical reactions in the body. So definitely the digestive system is important to break it down. That's the obvious part. The other not so obvious parts are the fact that the digestive system and the brain are connected intricately by nerves. In fact, the digestive system is called the second brain. And the reason why it's called the second brain is that it has, of all the organs in the body, of all the systems in the body, it has the next highest number of nerve cells. It has an intricate, highly complex nervous system, and it relays and regulates and does a lot of things, and it relays this information back and forth. So there's this super highway, so to speak, between the brain and the digestive system. As a matter of fact, some of the neurotransmitters, the things that make the brain work, actually created in the digestive system. And a good example is a neurotransmitter called serotonin. Serotonin has been hugely involved in research, especially in depression. And the drugs that have been created related to serotonin have become what they call blockbuster drugs. They've made a huge amount of money. Pharmaceutical companies have made a huge amount of money from serotonin-like drugs. But these drugs are made, 95% of them are made in the gut as opposed to the brain. In addition, they are consumed in the gut, close to 90% or some large number, ridiculous amount of that is being created and consumed in the gut. Also, there's another neurotransmitter you've probably heard of called dopamine, which is like the feel-good hormone or neurotransmitter. It's also made, quite a bunch of it is made in the gut. So again, this is just to talk about the importance of the gut to overall brain function. The other aspect that is gaining more and more prominence are the bacteria and the bugs. And when I say bugs, I like to use the word bugs more than bacteria because it's not just bacteria. We have viruses, we have parasites, we've got the plasmodia, all kinds of foreign, quote unquote, foreign material or foreign organisms in the gut that play a huge role in the transmission of impulses from the brain to the back to the gut. If that ecosystem is out of balance, and the actual balance should be 85% good bacteria or good bugs to 15% bad bugs, if that balance is offset, then chaos can ensue. And so we're saying that because we now see, and the technology is just beginning to develop to actually identify all these different bugs. When we were in medical school, we just knew a few kinds, but now with technology and imaging techniques, we can now see these bugs and actually see their action in the body. And so these bugs, why I'm talking about them so much, is that when we have kids with neurological disorders, you can almost guarantee that with that neurological damage, there has been the gut, whether it's the lining of the gut or the flora or the ecosystem of the gut or even the nerves of the gut have also been affected adversely. So it's not enough just to treat the brain and just treat seizures. We now know that to a very large extent, if we actually pay attention to the guts, improve gut health, improve the healing and the lining of the gut, and even directly affect the balance of the probiotics, what are known as probiotics, which are the good bacteria. There are things that we can do, again, using safe agents like what we call nutraceuticals. There are things you can do to actually address and even improve emotional health, cognitive health, brain function that we never thought was possible before. And I think this is really, really exciting, especially for those of us who live in third world countries where we don't have access to the kind of expertise that would deal with these conditions. Let me give you a quick example. We have fewer than 100 psychiatrists in this country. Psychiatrists are doctors who deal with the mind and mood disorders, emotional mood disorders. We have fewer than 100. Think about that. We have over 200, well, not over, but close to 200 million people in Nigeria. And a lot of us need help, I can tell you that right now. And it's getting worse, especially with the increase in abuse of drugs, illicit drugs. One of the producers was just talking about how in the next few years we're going to see an epidemic of mood disorders because of the use of these drugs. So we have a huge, huge, huge problem ahead of us. And I think that looking at the gut and paying attention to the gut, in addition to working with the brain, can take us so much further in dealing with these conditions and hopefully providing relief for these kids who, quite frankly, have done nothing wrong. They just were unfortunate to have not been given the right kind of attention, or they were in the wrong place at the time of their birth. So, to wrap this segment up, the gut-brain connection is crucial, and a healthy digestive system, I cannot overemphasize it, a healthy digestive system is crucial for brain function. And in the next segment, we'll talk a little bit more about that. Thank you. Welcome back to Your Health in Your Hands. We've been talking about neuro or brain disorders in children. And in the last segment, we spoke about the great secret of life, speaking about proper digestion, the digestive health, the health of your digestive system, and how that relates to proper brain function, but not just brain function, but also brain structure as well. So I felt that in this segment, we should just talk a little bit more about some specific examples and some of the things that we have seen from working with this knowledge that the brain and the gut are so closely related, and the health of one affects the other. So I have here a picture of the brain, a picture of the gut, and you can see the arrows pointing back, showing that there's a constant flow between the two. And so one of the things that really pointed out, really flashed this thing and blew this up in my mind was that we, at one point, we were having a lot of kids coming to the center, the Brain and Body Foundation, and they were asking for help, obviously, and a lot of them had cerebral palsy. And so at that time, we had a lot of omega-3s from a donor, and so we basically just gave out the omega-3s, and these are really concentrated, very healthy omegas. Remember, we've said before that your brain, the dry weight of your brain, if you take out all the water, what's left is what's the solid matter. 60% is made up of fat, and a good proportion of that fat is omega-3s. So it just makes sense that you give omega-3s to kids with brain disorders. You should give kids to everybody, but with brain disorders especially. Anyway, as I was saying, we gave these kids this omega-3s, and what kept on coming back to us was that the parents would say the kids would start stooling out in their stools. For the first time ever, first of all, they said the stools were black and very smelly. And then when we asked them more questions, we found out that most of these kids had very severe constipation. As in constipation, a day, 2 days, 3 days without having stooling at all. But when they started taking these omegas, it's almost like all that backed up stuff just began to come out. And the word again was that it was very smelly and very hard. But after they passed through that phase, the stool started getting better and more watery and more, softer. And they began to have regular stools. Sometimes the oil came out with the stools, which meant that the body was taking enough and the rest was given out. That was a pointer to me. The other thing they found out, the other thing they kept on reporting was that their child's state of health and alertness and was more alert and more alive than before. Again, it seemed like that's gut, as the gut was healed and inflammation was resolved, we began to see improvements. So that to me was like a woof, light bulb went up in my mind. I'm like, wow, we need to do this some more. So I began to look into it and began to really research and study more about the gut-brain connection. And so, like we said in the other segment, the bacteria and the flora in the gut also play a huge role. So we've had kids who've come with Down syndrome. Down syndrome is like a genetic condition. They usually have a specific feature, almost like a Chinese slanted eyes feature. They are usually short. Many of them are mentally, they're not up to par with their colleagues. Some of them can't even speak. A lot of them are hyperactive, and some actually have lung problems. So some of them are asthmatic and may have other conditions. Some may even have problems in their hearts. Anyway, we started looking at this whole gut-brain connection. And then I remember in one seminar I attended, he was talking about how they are now looking at the professor was saying, they're not looking at how the bacteria, the specific gut bacteria, how they can identify which person has this condition or which mental health this person has based on the poop in the gut. And he mentioned Down syndrome. So I said, whoa, maybe we should try that as well. So we got some probiotics, which are probiotics actually the good bacteria in nutrient form. So there's actually a way to capture this bacteria and put them in tablets and pills. Of course, you have to get the right kind, and you have to ensure that what you're taking in or giving to your child is of good quality, obviously, because there's a lot of bad stuff out there, quite frankly. And so what we did was that, I said, let's forget about the omegas for now. Let's just give these kids probiotics. And it's not like they started reciting Shakespeare all of a sudden. But some parents reported that the child was sleeping better. He wasn't as hyperactive as before. In some cases, some kids, the parents were complaining that it was always urinating on himself. He would go to school and all of a sudden he would just pass out his urine without any warning. And we saw that those problems actually began to abate simply on probiotics. So there's really something there when it comes to the use of probiotics. Another thing that we saw, especially in those who had severe brain damage, we had a patient who at I think about a year old or so, diabetic patient, and mistakenly they gave 100 times. Think about that, 100 times the insulin dose they were supposed to have, and boom, of course, it damaged the brain and shut things down. But the mother started complaining that some of this child couldn't digest food. I mean, she could still eat, but she couldn't digest food like before, and sometimes the stools came out unchanged. I mean, the food came out unchanged. And so that was a pointer too, that because the gut had been damaged, the gut had been affected, the enzymes that are supposed to be created by the gut or secreted by the gut were not like they should. And so we thought, why don't we also put enzymes? So there are nutraceuticals that actually have the enzymes prepared. So you just put them in the gut, give them to a child or to an adult. Maybe you're not digesting your food well enough. Some people have those problems. And that helped to digest the food. So this kid who used to have a bloated stomach before, the mother says that stomach just kind of went down because she now had the enzymes, the necessary tools to break down the food and extract the nutrients that she needed, and then they left the rest out. So there's a lot to be said for catering to the gut. Obviously, we can only mention a few here in this short time that we have. But again, things that you want to think about. You want to think about omega-3s. You want to think about probiotics. You want to think about enzymes. You want to think about the other things we've talked about, the vitamin D3, vitamin C. The reason why vitamin C is always coming up, and we're always talking about vitamin C, is that vitamin C is what helps to make collagen. Collagen is the most abundant protein in your body. It's what's part of the skin. It's what lines all the passages in your body. Collagen, your respiratory tract, your digestive tract, it's what lines that up. It's what helps to line the arteries. So the stronger your collagen is, the stronger your tissues are, the stronger your tissues will be. The weaker your collagen is, the weaker your tissues will be. And vitamin C is what helps to strengthen and make your collagen healthy. So vitamin C should not be left out of your program. So I hope this has served you. Remember, these are all part of a big picture. You want to check with your doctor, you want to see your doctor, because there are things that aren't covered by the food. Medication is very, very important as well. So don't just run off and do things by yourself. The key things that we wanted to talk about in all these programs is that your body actually has the tremendous potential to heal itself, and your child even has more because she's a child. So it just makes sense to support and give your child the right tools. I hope that has served. Thank you very much for joining us. Be sure to stay tuned next week for your health in your hands.